Welcome, and thank you for joining us today. My name is Ellen Wilson, and I'll be the moderator for this expert briefing for the media, which is hosted by the Johns Hopkins Bloomberg School of Public Health. Today's experts will discuss the impacts climate change is having on people's health due to the wide array of current issues, including flooding, drought, extreme heat, increased incidence of vector-borne illnesses, access to safe drinking water, and smoke from wildfires. First, I'd like to briefly introduce our speakers. Mary Fox is an assistant professor in the Departments of Health Policy and Management and Environmental Health and Engineering at the Johns Hopkins Bloomberg School of Public Health. She develops cumulative risk assessments that consider how biological, chemical, environmental, and social factors together affect the public's health. Megan Weil-Latshaw is an associate scientist in the Department of Environmental Health and Engineering at the Johns Hopkins Bloomberg School of Public Health. She translates environmental health science to policy and practice, with a focus on designing communities where the healthy choice is the easy choice. We will have time for questions following our speakers' remarks. We will take some questions that have been submitted in advance of the briefing and some from the Zoom chat. If you have a question, please enter it in the Zoom chat addressed to panelists and hosts. Please enter your name, media outlet, and question. We hope to cover as many as possible. Please note that participants are welcome to use images, video, or quotes directly from the briefing, and that the content is for immediate release. Participants will be muted during this briefing, and it will be recorded. Mary Fox, please go ahead.
Thanks. We're coming to you today from Maryland, where we set a high temperature record last week. And the world set a heat record back in July, according to the World Meteorological Organization. So these are just two recent experiences of our changing climate. And the World Health Organization considers climate change the biggest health threat facing humanity. So we're talking about climate change and health today. But I want to start by saying that stopping and responding or adapting to climate change requires an all-hands-on-deck strategy. Consider the sources of greenhouse gas emissions. So in the US, according to the Environmental Protection Agency, over half of our emissions come from the transportation sector or electric power production. And the impacts of climate are many and varied from place to place. We talked a little bit about extreme heat. There are other types of extreme weather events, like droughts and floods and water problems like that mean that our food systems are impacted, food safety is impacted, and we may be at increased risk of wildfire. So if we're just talking about public health, we're focusing in a little bit too narrowly, but public health agencies are a critical part of an effective climate and health response, and limited resources will really hinder our capacity to make an effective response. And just a quick example, again, from the US context, currently our CDC is funding only 11 state and local health agencies to do climate and health work. That's clearly not enough, and we need resources for everyone. So why is public health a key player? Health agencies gather and analyze population health data, so they know the health status of the people that they're responsible for and their vulnerabilities. And that's the kind of data that you need if you're going to be planning and implementing a climate and health program. You need to know where to put the cooling center, or you need to know which neighborhoods to start a tree planting program to help eliminate the urban heat island effect. So I want us to talk a little bit about a study that came out last year. We looked at the climate plans of a sample of large world cities that are climate and health active, like they are really doing work in this space, and we wanted to know how they're doing. Why cities? Well, we looked at cities because over half of the world's population lives in a city. And city health departments know their people, right? They're close to the ground and able to respond to the particular hazards of climate and health, where they are. So we found that 90% of the city plans that we looked at had health as a main goal of the plan. But only 70% of them actually had the health department engaged in the work. So how are they doing? Well, they're doing okay because they're using the all hands on deck strategy, right? They have the urban planners, they have the environment department, they have their electric utilities and their transportation sector, all contributing to the effort. But health data is a resource unique to health departments. And if you don't have your health department involved in your plan, you're missing vital information and a critical partner that's going to make your plan more effective. Thanks.
Thank you, Mary. Now we will hear from Megan Weil-Latshaw. Please go ahead, Megan. Oh, you're on mute.
Sorry, thank you. I just want to start off by saying, I hope I don't need to say this, but climate change is happening, right? We've all been seeing the effects with the heat waves across the world, and like the California wildfires and Hurricane Idalia. It's all happening more frequently and more extremely. Stopping it is key, yes. But even if we stopped it today, if we stopped emitting greenhouse gases, climate would still continue to change until we reach an equilibrium on the planet. And so what we need to do is we need to prepare communities for the impacts of climate change. And so a few years ago, we worked with the Trust for America's Health to measure how well prepared state health departments are. Mary talked about the importance of engaging state health departments in climate change preparedness. And we found there's a lot of work to do. So across the board, one of the things that we looked at is preparedness for everything. So if you're prepared to deal with a pandemic, you're also better prepared to deal with climate change, and vice versa. And what we found was that states can do better when it comes to things like social capital and cohesion, which is basically like the sense of community that you have, how often your neighbors check on each other, things like that. They could do better when it came to pre-hospital care, healthcare just in general, and even ambulances and things like that. And also, and I'm sure this is not a surprise, but states can do better with mental and behavioral health care. And all of this is important in responding to climate change, as well as any other disaster that might happen. A lot of states we found had identified climate hazards, but they actually hadn't linked them to potential health effects. So they might have said, oh, we know that we're at risk of flooding, but then they didn't actually say, well, flooding can lead to mold, that can lead to asthma. And so a lot of states still need to make those connections between the climate hazard and the health effect. And they need to do much more around intervention. So interventions is basically what a health department does to hopefully prevent health issues from happening in the first place. And so one example of an intervention around climate is a heat warning system. And we need more interventions like that. And we actually need a lot more research to figure out which interventions actually do work and are helpful, because we have limited resources, right? I just want to point out one of the things that we found were the states that were most vulnerable to climate change were also the least prepared, which is the opposite of what we would want to see. We would want to see the most vulnerable be the most prepared. And we originally recommended developing a national strategy, which the Department of Health and Human Services did. They created a climate adaptation plan, but we also recommended funding programs at CDC. Mary mentioned one of the programs, and at NIH to study these interventions, as well as at the state level. Now you might think, well, there's lots of money in the Inflation Reduction Act, and that went toward climate change programs, but it didn't go to CDC. It didn't go to NIH. It didn't go to the Department of Health and Human Services. Most of it's going to agencies like EPA, which are important, but we also need that health piece. And so I am going to stop there.
Great. Thank you so much, Megan. Now we will turn to questions. As we've stated, please, if you have a question, enter it in the Zoom chat with your name, media outlet, question, and to whom you'd like to address your question. Megan, just to start with you, which states were they, the ones that were most vulnerable and least prepared? Oh, you're on mute, sorry.
And we'll get the hang of this. So the states that are there we go. Okay, I am unmuted this time. The states that were most vulnerable and least prepared tended to be in the South. They were Georgia, Kentucky, Mississippi, Oklahoma, South Carolina, Tennessee, Texas, and West Virginia.
Great, thank you. And a follow-up to that for Megan, what are some practical things everyday people can do to mitigate the effects of climate change on their health?
Yeah, so, a lot of what I talked about were things like policies that we can do and funding opportunities, but each of us every day, we contribute to greenhouse gases. And, even just being on my computer and talking to you, I'm using electricity, which, contributes to greenhouse gas emissions. So I think we can all think of ways to lower our greenhouse gas emissions. But then when it comes to protecting health and adapting to climate change, we can do things like check air quality alerts, right? During the wildfires, those alerts were being used a lot more than they ever had been before, especially the wildfires in Canada and California. And we can do things like check on our neighbors. I mentioned, social cohesion. We can make sure that maybe our elderly neighbors or people who might not be able to afford air conditioning, that they're doing okay, and let them know about any resources like cooling centers that might be there. So there's lots of little things that people can do.
Great, thank you. Question for Mary. You mentioned that states need to do more to prepare communities for climate change impacts. Can you give us a few examples?
Well, so the way kind of the public health system works is kind of nested, right? So a state can prepare resources and training materials, for example, that then can be used by local health departments in doing, say, a school outreach program. So making sure that the students and teachers at the school kind of know what the situation is, where they are, and how they can respond. So I mean, that's just one kind of quick example.
Great, thank you. Megan, what are the specific effects of climate change on human health? And have these increased in recent years as the climate has warmed?
Yes, they are definitely increasing. So for example, something that impacts me that I care a lot about is allergy season is actually longer, because with increased heat, we're seeing increased things that generate pollen. And so that's just one example. I mentioned floods and I mentioned mold issues. Floods can also lead to injury. You see people out walking in a flood and they might trip on something or drown and die. And then also during flooding, there's drinking water concerns. If you're on a well system and flood waters get into your well, into your drinking water, that's a health issue. And also, diseases like mosquitoes. I mentioned that pollen is something that is increasing because of climate change, but mosquitoes, in Maryland, we just had a case of malaria, and it wasn't a case that was linked to somebody traveling somewhere where malaria happens. It was a locally transmitted case. They hadn't been traveling. And then lastly, I'll mention one of the other impacts that I think is getting more and more attention: mental health impacts. So, it's not just a question of my home was just destroyed by floods. What am I going to do? I'm having a mental health crisis. But there's also this underlying sense of dread that we're seeing in children when we talk to them about climate change. And so there's a lot more attention being paid to the mental health impacts as well. And those are just some examples. There's a lot more.
Great. Thank you so much, Megan. A question for you from Lena Sun at the Washington Post. Which states are the most prepared? Um, what kind of programs do they have in place that make them well prepared?
Sure. So the states that were the most prepared to deal with the health effects of climate change were Utah, Maryland, Vermont, and Virginia. And just like one story by way of example from Vermont is, the Department of Health there partnered with the state's urban and community forest program. And they provided 500 trees to residents in 4 communities that had been identified as high risk for the heat vulnerability index. And so by increasing tree cover, that is just one way to sort of do an intervention to reduce the health impacts of climate change.
Great, thank you. A question for you, Mary. How can federal agencies, states, and local health agencies work together to ensure communities have the resources and support they need?
Well, I mentioned one example in my introductory remarks. So CDC does have funding. It's a limited amount, as I mentioned, right? So we're not able to fund everybody all the time to do climate and health work. And actually, another way that that public health agencies work together is that one of the functions of our CDC at the national level is to develop resources. And one of the resources that they have is it's a climate and health action framework, right? And so it can be used by anyone at any level to assess health threats, to plan interventions and programs, as Megan has been talking about, and then to implement and evaluate those programs. So that is a resource developed at the national level that can be used by anyone, wherever they are, to begin a cycle of kind of understanding what the climate hazards are, what the health vulnerabilities are, and then planning out and implementing the different types of programs that would help protect people.
Great. And Mary, a follow-up, just digging deeper into, we asked you about the states, but specifically the health departments, what really should they do to support residents?
Well, so I think one thing is just to be an advocate, right? So I mentioned that health departments have a good tab on health data and the population health status in different places. And so knowing what the problems are in any particular place and kind of being in the government level where you can interact in this sort of this all hands on deck idea, right? So maybe the health department can advocate with urban planners for, making the right kind of change, or building a fountain. Who knows what kind of creative public work may be helpful for climate health protection. So health departments can advocate. Health departments can evaluate the climate program that has been put in place, right? And that is one of the key contributions of that health data, right? So you can do a program and it may not be working, right? And the only way you would know is that if you can do kind of a before and after health study. And that's also an important area of expertise for health departments. And one more thing I'll mention, just sort of from the Baltimore City example. So in Baltimore's plan, the city health department is tasked with health studies of things like foodborne outbreaks, and not just sort of after the fact, but also trying to anticipate them and figuring out like what are the types of food safety systems that we need to prevent those events.
Great. Thank you so much, Mary. And for Megan, to this point, how much funding is being devoted to the health impacts of climate change in the U.S.?
So I'm not sure of the exact figure. I think Mary had previously mentioned that there's less than half of the states are funded by CDC to work on climate and health. Some states may receive state funding to do that, but I'm not the expert on that. I will say that just even if you don't have funding from CDC, every single state health department should complete all of the steps of CDC's, they call it the BRACE framework. It stands for Building Resilience Against Climate Effects. Just because the state doesn't have funding from CDC to do that doesn't prevent them from doing it anyway. And I think every state should do that.
Great, thank you. And Megan, here's a question from Marina Kopf at NBC News. Could you speak to the relationship between climate change and norovirus?
That is a good question, Marina. I cannot, off the top of my head, speak to that particular virus. I don't know, Mary, if you have any knowledge about it.
Well, not specifically, but I would say that we talked about the recent heat waves, right? Both kind of regionally here where we are in Maryland and then globally. And I've heard some on the news about the warming ocean temperature, right? So warming waters we're in Maryland here, we love our crabs and our shellfish, right? So when we are harvesting from the Chesapeake Bay in warmer waters, the pathogens are also more likely to be present. And so that kind of increases our foodborne outbreak risk. So that's one of the ways that you sort of have to connect the dots between like extreme heat that's being driven by climate change and sort of down the chain of events to, increased risk for foodborne illness. So I'm sorry, I can't speak to norovirus specifically, but just a little bit of the bigger context around that.
Yeah, that's great. Thank you, Mary. Megan, what are the mental health impacts of people dealing with various climate change scenarios, specific mental health issues people are dealing with?
Yeah, so, during an event, I think the mental health issues are pretty clear. There's distress at what is happening to maybe my home or my health or something like that. There can be grief that goes along with some, weather-related disasters. Some behavioral health disorders are linked to climate change. Maybe during these events, you're more likely to drink or to smoke, or maybe you're not getting exercise. Some of the basic behavioral health things that we recommend people think about. There's also the social impacts. So during weather-related disasters, a lot of times people leave their home where they and their families have lived for ages, and they become disconnected from the people that they know and feel comfortable with and their culture. But then, if you back it up and you're not even just thinking about disasters, there's maybe potentially a constant sense of worry about, when is the next storm going to come, or am I going to be impacted by the next wildfire? And then even, further like down this continuum is this sense of doom that some people have when they talk about climate change, and a sense that nothing we do can help, and that is so wrong. There is so much that we can do, and experts have laid out what needs to be done to make sure that climate change doesn't tip over and reach that tipping point that everybody always talks about. So those are just some that come to mind.
That's fantastic. So we've come to the end of the questions, and if either of you would like to make just a closing comment, please go ahead. And I'll start with you, Megan.
Sure. Lena had asked for stories, and I gave her one from Vermont, but since we have a little extra time, maybe I'll also talk about Michigan, where the health department had helped pilot test these tools around heat using CDC funding. And there was one where they mapped vulnerability to heat as well as land surface temperature, so the temperature of the land. And during that time, they did 3,000 surveys, and they asked residents in 2 local health departments about their readiness to deal with heat. So back in like 2012, there was this big heat wave, and they were basically ready to look at people's symptoms in emergency departments visits, and they were able to provide public health messaging to the populations that needed it the most because of this prep work that they had done. So that's just one other example.
That's awesome. Thank you.
Mm-hmm.
Mary, do you have any closing thoughts, anything you'd like to add to the discussion?
Well, sure. One thing I can talk a little bit more about is Baltimore's plan, since I'm here and coming to you from Baltimore City today. And it has to do with preparedness. Actually, Megan talked a little bit about this. I talked a little bit about this. Baltimore's plan is, the climate plan is part of an all hazards plan that was actually put together with funding from the Federal Emergency Management Agency. So we haven't even talked about FEMA's role in this, but and it goes back to flood risk, actually, and controlling flood risk and kind of insurance related to floods. But FEMA sort of funded this effort for Baltimore City, and having it as an all hazards plan. So it's not just climate, it's other things. But some of the programs, like early warning systems that are really effective for heat, for example, also very effective for other types of both climate and other emergencies, right? So flooding can also be effectively kind of, the risk and warning and kind of get out of the way can be effectively mitigated with early warning systems, as well as other types of things like earthquakes, for example. So some of these key programs and activities work for more than just climate, and actually it makes a lot of sense to bundle things in a way. You sort of get more bang for your buck, and as we've been talking about, resources in this space, at least kind of on the public health side, have been relatively limited. But the all hands on deck strategy is very effective, and we need it both just for health, for responding, but also to slow and stop the climate change. And that's kind of the bottom line. Like that's what we need to be. That's really what we need to be doing.
Awesome. Thank you so much to you, Megan Fox, and to Megan Latshaw, Mary Fox, for your presentations and insightful answers. And we will email everyone the links to the resources mentioned today and shared in the chat. And with that, I'd like to say thank you to everyone for joining us today.
I agree. Thank you.
Thank you.